Cranial nerves. This is what nerve? Vagus.
Vagus.
Так,
Nervus vagi.
boys, all look the body. This is nervus vagus. Yes, it's what? This is nervus phrenicus. It's a mixed nerve that innervate the diaphragm, pleura, pericarp, and liver. And some battles go to the liver. We have a phrenicus syndrome. When doctor touch the musculus sternocleidomastoidus, in normally not you have problem with liver.
No, I don't. No. See, I don't have to.
If doctor teach the musculus sternocleidomastoidus and person feel the pain in abdomen, maybe he have problems with the liver, because liver making a very big capsules is strange and signal from nervus phrenicus go to the musculus sternocleidomastoidus. What is this nerve? Nervus hypoglossus. With the cervical plexus, it's making ansa cervicalis profunda. Superficial, we see on this picture. Profunda, nervus hypoglossus communicate with the cervical plexus. And what innervate?
Fascis.
What innervate this loop?
Platysma.
No, platysma superficial, deep. Nervus located below osteoidus, musculus omohyoidus, sternothyroidus. Yes. How you think? What is this nerve?
Auxiliaris.
This is nervus axillaris inferior, and what is this muscle? Lingualis. This is nervus lingualis. This is nervus axillaris inferior. From what nerve? Nervus axillaris. Nerve number 5. Nervus 3. Geminis. Yes. This is sternocleidomastoidus. I not find the accessorius, but accessorius should go to the musculus sternocleidomastoidus. Maybe on not see. And this is skin branches of cervical plexus. Nervus accipitalis minor, nervus auricularis magnus, nervus thoracicus coeli, transversus coeli, yes, and nervus supraclavicularis. It's skin branches. They go to the skin. And on this side, I think more better, we can see nervus. Now I take nervus axillaris. In your material in Moodle, nervus axillaris is part of short branches. But for example, in Russian book, nervus axillaris writing in long branch. But on the exam, more better say it's a short. But if you say it's long, it's not mistake. Because, for example, when I study, we teach that nervus axillaris is a long nerve. This nerve going to the fossa axillaris. At home, revise the borders of fossa axillaris and cavitas. The leaf body have fossa because have a skin. This body have cavitas axillaris, and then nervus axillaris go to the foramen quadrilaterum. Foramen quadrilaterum. This is what muscle? How you think? Musculus teres major, minor, and this is nervus quadrilaterum. In this place passes the nervus axillaris, then innervate musculus deltoideus and musculus pectoralis minor, and the terminal branch innervates skin above the musculus deltoideus. It's about nervus axillaris. Brachial plexus. Plexus brachialis. It's made by 4 lower cervical and spinal nerves and first thoracic spinal nerves, and it's located between musculus coleni anterior and medial, and then go to the fossa axillaris, and short bundles located above the clavicula, long below the clavicula. What short we can see? One. You see this branch? Go to the musculus serratus anterior. How it's called? Musculus
Transverse longus.
Musculus thoracicus longus. Go to the musculus serratus anterior. one branch go to the what I see. Go to the what muscle I take? What muscle?
Rhomboid.
No, big.
Latissimus.
Musculus latissimus dorsi. Nervus. How called nerve? Nervus. How called nerve? How called nerve?
Dorsalis.
Latissimus dorsi.
Subscapularis.
No, subscapularis.
मैंने कॉपी दियो
No, subscapularis.
Subscapularis.
Subscapularis. And then it's have a name. How it's called in Moodle's writing? Have an independent name. In Moodle's writing,
किसका वाला पूछ रहे
thoracodorsales.
इसका है ना देखो latissimus dorsi terminal branch latissimus called nervus thoracodorsales.
Nervus thoracodorsales. It's part of nervus. Yes, this nervus thoracodorsales. Go to the platysma. Nervus pectoralis minor venozzi. Nervus subclavius venozzi. What else? Nervus subclavius I show you. And today we discuss the long branch. At the beginning we find the axillary artery. Так, boys. Axillary artery. Так. You should take axillary artery, fine. And then you can see 1, 2, так, 1 second, I make 1 bundle, it's medial bundle, 1 bundle, it's lateral bundle, and behind arteria axillaris, posterior bundle.
Posterior, medial, and
Yes, lateral. These 3 bundles surrounding arteria axillaris below the scapula. Understand? The long branch of brachial plexus below the scapula, I'm confused. Below the clavicula, surrounding arteria axillaris on 3 sides: lateral, medial, and posterior. This is, I show now, medial, I see. This is lateral and behind posterior. 3 bundles. Bundles lateralis, medialis, and posterior. And from these bundles, beginning a long branches of brachial plexus, and begin we with the medial plexus, I think, medial, 1 second. This is medianus. This is Так, begin with the lateral. With the lateral. This is nervus musculocutaneus. Nervus musculocutaneus located more lateral. Beginning in, now I take lateral bundles. How say? Pointer, yes, take. I see the lateral. This is arteria axillaris, lateral bundle. And in this bundle, more lateral beginning,
the cutaneous.
nervus musculocutaneus. Nervus musculocutaneus. This nerve penetrate musculus coraca brachialis, then go to the arm and innervate all anterior group muscles. It's what muscles? Musculus biceps brachii. What else? It's part of musculus biceps brachii. What else? Musculus coraca anterior group, coraca brachialis, and musculus brachialis. 3 muscles. I show you on the picture. We find on this picture musculus biceps brachii with 2 caput.
Long and short.
Sorry, I show long. Yes. Musculus biceps brachii have 2 caput. Musculus coraca brachialis begin on the coracoideus of scapula, and musculus brachialis. 1, 2, 3. 1, 2, 3. 3 muscles of anterior group. Musculus coraca brachialis, musculus biceps brachii, and musculus brachialis. These 3 muscles innervate nervus musculocutaneus. And then terminal, the last branch on this nerve, innervate the lateral part of our forearm. In Latin, it's called nervus cutaneus. Cutaneus is skin. Nervus cutaneus antebrachiolaterales. I remember arm brachii in Latin, forearm antebrachial. In Latin, it's called nervus cutaneus antebrachiolaterales. I show now and innervate this lateral surface of my only lateral forearm. Understand? Nervus musculocutaneus. We innervate all three muscles of anterior group, and then terminal branch innervate the skin of lateral surface of my forearm. Understand? Nervus musculocutaneus. Begin in the lateral bundle. This is lateral bundle. Nervus musculocutaneus. Understand what innervate? We penetrate musculus coracobrachialis, then go to the sulcus bicipitalis lateralis. I remember on the two sides of musculus biceps brachii we have two sulcus, bicipitalis medial and lateral. This nerve located in sulcus bicipitalis laterale because located on lateral side. We innervate all muscles of anterior group of arm, then go to the forearm and innervate the skin. Nervus cutaneus antebrachiolaterales. Understand musculocutaneus? The next nerve, you can very easy find this nerve because it's looking like a fork. I see fork. Like
Y shape.
Y, yes. I see Y shape. And two beginning surrounding the arteria axillaris. One radix begin in the lateral bundle, one radix begin in the medial bundle. And then it's fused and making one. Nervus medianus. All see. It's very easy find. Nervus medianus. Have two radix, lateral and medial. Lateral beginning near the nervus musculocutaneus, I see. More lateral nervus musculocutaneus, more medial nervus medianus. Have two radix because looking like a fork. Have two radix, lateral and medial, but then they fuse to one, nervus medianus. This nerve on the forearm, located in the sulcus bicipitalis lateralis 2, near the nervus musculocutaneus. But on the forearm, it going transit. This nerve not innervate muscles, not innervate skill on the forearm. It's going transit. And then on the forearm, it's on this arm. I not find, but wait, careful. Nervus medianus, this. Nervus medianus lies in the sulcus medianus of forearm. I remember on the forearm we have three sulcus: ulnaris, radialis, and medianus. This is where located the sulcus medianus between what muscles? What muscles of forearm anterior group? You remember? Brachioradialis. I think
This one.
very.
वो तो छोटा होगा
Musculus
ये वाला
brachioradialis, then musculus flexor carpi radialis, small lateral, then musculus flexor palmaris longus, then
no 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 no
Palmaris is a small one, na?
maybe it's this palmaris. This is digitorum superficialis, I think. Musculus flexor digitorum superficialis, and
then
this is brachioradialis. This is musculus flexor carpi radialis. Yes. Where the- And then it's thin and long. Musculus palmaris longus. Maybe this. Musculus palmaris longus. Then musculus flexor digitorum superficialis. And then going musculus flexor carpi ulnaris. The sulcus medianus located between musculus flexor digitorum superficialis and musculus palmaris longus. In this place, between these two muscles. In this place located sulcus medianus and innervate anterior group muscles, but not all, except musculus flexor carpi ulnaris and musculus brachioradialis. It innervate nervus radialis. We talk about this small letter. We innervate all superficial muscles except musculus flexor carpi ulnaris. This nerve innervate nervus ulnaris and musculus brachioradialis. This muscle innervate nervus radialis. It's about superficial group. So, what muscles we innervate? Musculus flexor carpi radialis, musculus flexor digitorum superficialis we innervate, and musculus palmaris longus. These three muscles we innervate, another not. Understand? It's about superficial layer. And we have musculus pronator teres. And innervate musculus pronator teres. Sorry. Musculus pronator teres should be in this place. Так, this posterior. Musculus brachioradialis. This is musculus
Anterior or
palmaris longus, digitorum superficialis, musculus flexor carpi ulnaris. This is radialis, and in place should be musculus pronator teres. Musculus pronator teres, and this nerve innervate this muscle too. Revise. Nervus medianus on the arm, not innervate muscle, not innervate skin, innervate no. How say nothing? Nothing. Ничего.
Nothing.
I correct understand this?
Yes.
Nothing.
Yeah.
Innervate nothing on the arm, and on the forearm innervate anterior group, superficial, but not all, except musculus brachioradialis, except musculus flexor carpi ulnaris, another innervate, and innervate ulnaris, not innervate, radialis innervate, musculus flexor carpi ulnaris innervate nervus ulnaris, musculus brachioradialis innervate nervus radialis. Another muscles of superficial group innervate nervus medianus. This is musculus pronator teres, musculus flexor carpi radialis, musculus palmaris longus, and musculus flexor digitorum superficialis. Understand?
Can you tell one name of this muscle?
Musculus pronator teres. Musculus pronator teres. And then this nerve innervate deep muscles. This is musculus pronator quadratus, musculus flexor digitorum profundus, but only one part. Understand? Musculus flexor digitorum profundus located below the superficial, but only one part. Understand? Because two nerves innervate this muscle. And musculus flexor pollicis longus. These muscles innervate nervus medianus. Superficial group except two muscles, and all deep group except one part of musculus flexor digitorum profundus. Innervate about forearm. And then nerve passes from canalis carpalis below the retinaculum flexorum and go to the hand. And on the hand we have two branches, skin and muscle branches. If we say about skin branches, you can teach it how it's teach the Russian students. You know the word in English it's called die, умереть, die. This person is dead. Dead. In Russian, maybe you hear word умереть. Умер. We have word umru. Умру. Nervus ulnaris, nervus medialis, nervus radialis, nervus ulnaris. Umru. M located on this side. Umru. And we innervate tenor. Tenor is elevation of first finger. We innervate tenor, and we innervate first, second, third, and lateral side of third finger. Understand? we innervate tenor. It's elevation of big finger. First, second, third, and lateral surface of fourth finger. Nervus medialis. U, M, R, U, M. 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 U, M, R, U, M. Tenor, first, second, third, and one part of fourth finger. Understand? Innervate nervus medianus. Yes, and only one half lateral part of fourth finger. It's about skin branches. Understand? And we have a muscle branches. We innervate muscles of tenor. Tenor. Muscles of tenor, it's muscles of first finger. What muscles of tenor you remember? Musculus flexor pollicis brevis, musculus abductor pollicis, musculus flexor pollicis, and musculus opponens pollicis. Opponens pollicis, opponens. Flexor, opponens, adductor, and musculus
brevis.
flexor, and musculus extends, musculus flexor pollicis brevis. Flexor, yes. 1 second.
फ्लेक्सर ये है, पॉलिसिस ये है.
Revise muscles is
करो करो करिश्मा. कल से डांस करो. इसको की वो अच्छा.
musculus abductor pollicis brevis, musculus flexor pollicis brevis, musculus opponens pollicis, and musculus adductor pollicis. Musculus adductor pollicis, musculus opponens pollicis, musculus abductor pollicis brevis, and musculus flexor pollicis brevis.
How is abductor and abductor?
This is adductor, abductor. Adductor. Adductor, abductor. Two hand, adductor, abductor. Flexor and opponens. Four muscles of tenor. But this nerve innervate musculus abductor pollicis brevis and musculus opponens pollicis. Only two muscle. Understand?
In which?
Of tenor. Only two muscle. Now we revise all four muscles, but nervus medianus innervate only musculus abductor pollicis brevis, and musculus opponens pollicis brevis. These two muscle innervate. And we innervate, I remember the muscles of finger, musculi lumbricalis. Musculi lumbricalis. We innervate musculi lumbricalis 1, 2. Musculi lumbricalis 1, 2. It's about a muscle branches. Now revise. Nervus medianus, this nerve I show you, have two radix, lateral and medial. Lateral begin in lateral bundle, medial begin in medial. In medial bundle. Surrounding arteria axillaris. One radix on the lateral side located, medial on the medial side. They are surrounding arteria axillaris. Then this nerve located in the sulcus bicipitalis lateralis transit the arm and not innervate nothing. Then we go to the forearm located in sulcus ulnaris and innervate anterior group muscle of forearm. Superficial layer, it's all muscle except musculus flexor carpi ulnaris and musculus brachioradialis. And all deep muscles except musculus flexor digitorum profundus. Only one part of this muscle, another innervate. It's on the forearm. Then from canalis carpalis, its nerve go to the hand, only to the palmar surface. This is dorsal, this is palmar surface. And skin branch innervate skin of tenor and skin of first, second, third, and lateral part of fourth finger, skin. And muscles of tenor only musculus abductor pollicis and musculus opponens pollicis, and two musculi lumbricalis, first and second finger. Understand? U, me, re, u, m. You can teach it like this. Take your hand, u, m, r, u. 4 points. Nervus medianus. Understand nervus medianus? Так, about lateral bundle we end. Have two nerve. Nervus musculocutaneus. More lateral. And one radix of nervus medianus. It's about lateral bundle. Now we begin a medial bundle. In medial bundle we have medial radix of nervus medianus and nervus ulnaris. Guys, now I show you nervus ulnaris. Nervus ulnaris on the forearm located in the sulcus bicipitalis medialis. Understand? In sulcus bicipitalis lateralis B nervus musculocutaneus and nervus medianus. In sulcus bicipitalis medialis located nervus ulnaris. This nerve on the forearm, like nervus medianus, not innervate muscles and not innervate skin. Like a nervus medianus, it's going transit. Understand? Passes transit, not innervate something, and then go to the forearm and locate it in the sulcus ulnaris. Sulcus ulnaris located between musculus flexor carpi ulnaris and musculus flexor digitorum superficialis. Yes, in more medial, and light in this place. And on the forearm we innervate two muscles. Musculus flexor carpi ulnaris. Nervus medianus, how I say, not innervate this muscle. Musculus flexor carpi ulnaris and one part of musculus flexor digitorum profundus. Understand? Musculus flexor digitorum profundus take innervation of two nerves, medianus and ulnaris. Understand? So, two nervus medianus and nervus ulnaris innervate all muscle, superficial and deep layer of anterior group of forearm. Nervus medianus, nervus ulnaris. We innervate all muscle of anterior group of arm. Understand? Then muscle or then nerve go from the canalis carpi ulnaris to the hand. Go to the hand. How I say U, M, R, U. And on the palmar surface, we innervate elevation of small finger, hypotenar. This is tenar, this is hypotenar. We innervate hypotenar and little finger and half of forefinger. Understand why? Because nervus medianus innervate lateral surface of fourth finger, nervus ulnaris innervate, don't sleep, Garnet, innervate the medial surface of forefinger. Understand? U, me, re, u. Guys, it's not all listen. U, me, re, u. Nervus ulnaris, umru, u. Innervate hypotenar, skin elevation of small finger and half of forefinger. And nervus medianus, hypotenar, first, second, third, and half of this. Understand? And skin of palmar surface we ending innervate. Understand? Palmar surface of hand innervates two nerves, medianus and ulnaris. All understand? And how we say U, M, R, U. This nerve go to the dorsal surface too and innervate skin of dorsal. 5 finger little, 4 and half of third finger on the dorsal surface. Understand? 1, 2 and half of third finger skin. U, M, R, U. It's only one nerve that innervates skin of two surface. Understand? U, nervus ulnaris, innervate palmar surface, hypotenar, small finger and half of forefinger. And on the dorsal surface, we innervate all small finger all forefinger and part of third finger on the dorsal surface. It's about skin branches. Skin we innervate. And now this nerve have a muscle branches. We innervate all muscles of Gippotenar. It's what nerves? Musculus palmaris brevis, musculus opponens digiti minimi, musculus flexor digiti minimi, and musculus adductor digiti minimi. All these four muscles innervate nervus ulnaris. Understand? All four muscles of Gippotenar. And nervus ulnaris, 1 second, what else? Maybe I forgot to say something. We innervate musculi lumbricalis number 3 and number 4. 1, 2 innervate nervus ulnaris, 3, 4 innervate nervus, 1, 2 nervus medialis, 3, 4 nervus ulnaris. All muscles of Gippotenar and I think Gippotenar and musculus adductor pollicis, because nervus medianus not innervate these muscles, and deep head of musculus flexor pollicis brevis. Understand? All muscles of Gippotenar and 2 muscles of tenar. Musculus adductor pollicis and deep head, because musculus flexor pollicis brevis have 2 heads, superficial and deep. Superficial innervate nervus medianus, deep innervate nervus ulnaris. Understand? Revise. Nervus ulnaris exit in medial bundle. This is nervus medianus. On the forearm, this nerve located in the sulcus precipitalis medianus and don't innervate muscles, going transit. Then we go to the forearm. This nerve located in the sulcus ulnaris between musculus flexor carpi ulnaris and musculus flexor digitorum superficialis. And on this surface, we innervate 2 muscles, musculus flexor carpi ulnaris and 1 part of musculus flexor digitorum profundus. Only 2 muscles innervate, because another muscles innervate nervus medianus. Understand? Then from the canalis carpi ulnaris we go to the hand, innervate the skin of Gippotenar and skin of little finger and half of forefinger on this surface, and on the dorsal surface we innervate skin of little finger, forefinger, and half past of third finger. And muscle, we innervate all muscle of Gippotenar. This is musculus palmaris brevis, musculus opponens digiti minimi, musculus flexor digiti minimi, and musculus abductor digiti minimi. And 2 muscles of tenar, musculus adductor pollicis and deep head of musculus flexor pollicis brevis. And 2 muscles, musculi lumbricalis 3 and 4. This is all what innervate nervus ulnaris. Understand nervus ulnaris? And in lateral bundle, revise. In lateral bundle, beginning a medial radix of nervus ulnaris, lateral part of nervus medianus, lateral part of medial part of nervus medianus, nervus ulnaris, and I see a very thin nerve. This is nervus cutaneus. Nervus cutaneus, and we have 2. I see 1. Just 1 second. Maybe after lesson I make this. 1, 2. I see 2 nerve. They are thin. This is cutaneus, innervate skin. Nervus cutaneus antebrachi medialis and nervus cutaneus brachi medialis. Understand? 2 cutaneus nerve. Nervus cutaneus brachi medialis innervate. It's sensitive nerve. These 2 nerves innervate only skin. Nervus cutaneus brachi medialis, nervus cutaneus antebrachi medialis. Understand? Muscle will not innervate. It's sensitive nerves. Innervate only skin. 1, 2. You can show it on exam like this. Nervus cutaneus. One go to the arm, second go to the forearm, and innervate medial. Only medial. Yes. Now I show you what innervate. This part and this part. It's about nervus cutaneus. And what bundle we not discuss? Posterior bundle. This is lateral bundle. This is medial bundle. And
Below that. Posterior.
bundle. Nervus axillaris. In Russian book, nervus axillaris, it's part of long bundles and begin in the posterior bundle, nervus axillaris. And we discussed this nerve innervate musculus deltoideus, musculus teres minor, and skin of musculus deltoideus. And second nerve, nervus radialis. Now I take nervus radialis. And you see posterior group. You see, I take arteria axillaris. We can see lateral bundle, medial bundle, and posterior bundle. You should take very careful arteria axillaris and below arteria axillaris posterior bundle, lateral bundle, medial bundle, posterior bundle. Understand? Parts of posterior bundle, nervus axillaris, go to the foramen quadrilaterum, and second, nervus radialis. This is nervus radialis. This nerve go to the canalis radialis or spiral canal, canalis spiralis. On the previous year we discussed this canal. Maybe you don't remember. If we remember the structure of humerus, on the posterior surface we have sulcus nervi radialis. It's going like this. I have a pic. I maybe in atlas I can show you. We begin on the superior surface and middle, and then going down to the lateral surface. I show you in the atlas, because nervus medianus have interesting direction, interesting way. Так, 1 second. Red nerve. We go to the canalis spiralis. This is humerus, and on the posterior, you see how it's going? From medial superior to lateral inferior surface, like spiral. So it's called spiral canal, because it's going like this. Understand? So on the forearm, this nerve located in canalis spiralis. Canalis spiralis located between musculus triceps brachii and humerus. Between musculus triceps brachii and humerus. You can see. We go, and I go to the canal between humerus and musculus biceps brachii, long caput. We enter in this place, then going like this, like spiral, and exit we between musculus brachii radialis and musculus brachialis. Understand? And then nerve going, this is nervus radialis. And then it's go to the posterior surface of forearm. Understand? We enter in this place, go to the canalis spiralis. You say canalis spiralis located between musculus triceps brachii and humerus. Then go in this place. Exit between two muscles, musculus brachii radialis and musculus brachialis, and then go to the dorsal surface. So it's have spiral direction. And what we innervate? On the forearm, we innervate all muscle of posterior group. It's what muscle? Musculus triceps brachii and second muscle, musculus anconevus. Two muscle, half or posterior group. Musculus triceps brachii, all three caput, long caput, medial and lateral, and small muscles, musculus anconevus. Understand? Nervus radialis innervate all posterior muscles of arm and all posterior muscles of forearm. What? I remember posterior muscles of forearm. 1 second. Musculus extensor. Musculus extensor. Господи, musculus extensor. Как они? Musculus extensor. No, flexor anterior group. Musculus extensor. Who remember muscles of posterior? Musculus extensor. It's two muscle, long and short. Musculus extensor. Carpi. Carpi ulnaris, longus and brevis. Radialis.
This side radialis.
Yes, radial. Yes, you could say right. Musculus extensor, carpi, radialis, longus and brevis. Then nervus extensor digitorum. Next, musculus extensor digiti minimi. And musculus extensor carpi ulnaris. Understand? This is musculus extensor carpi ulnaris, medial. Musculus extensor digiti minimi, musculus extensor digitorum, and this is part what stay of muscle, musculus extensor carpi radialis longus and brevis. All this superficial muscle innervate nervus radialis, and all deep muscle, musculus extensor indicis, it's a third finger, musculus extensor pollicis longus, musculus extensor pollicis brevis, and what else? And musculus, all muscles of deep group. All muscle of deep group on posterior surface. Innervate nervus radialis. Then this nerve go to the dorsal surface of hand. How we say? U-M-R-U-R. On dorsal surface, we innervate finger 1, 2, and half of 3. This innervate nervus ulnaris. Nervus ulnaris innervate little finger, third and half of fourth. And nervus radialis innervate this half of fourth, second and first. Understand? It's about skin. And on the way, its nerve give nervus cutaneus brachii superior, nervus cutaneus brachii lateralis, innervate this surface, and give nervus cutaneus antebrachii posterior. Nervus cutaneus antebrachii posterior. Innervate skin of this surface, innervate skin of posterior surface of arm, nervus cutaneus brachii posterior, nervus cutaneus brachii lateralis, and nervus cutaneus antebrachii posterior. Understand? Nervus radialis innervate skin of arm, skin of forearm, and skin of first finger, second finger, and half of third finger. Understand? And I think it's what else innervate. Innervate wrist joint. Innervate wrist joint. All muscles of back group. Yes, this is all about nervus radialis. Revise nervus radialis. Nervus radialis located in spiral canal in the arm. Then and innervate the palmar surface, first, second, third, and half of forefinger. Nervus ulnaris on the palmar surface innervate half of forefinger and fifth finger. And nervus ulnaris on the dorsal surface innervate little finger, forefinger, and third finger. And nervus radialis innervate big finger, second and half of third finger. Understand? It's a about innervation skin of hand, and this is innervation skin of arm and forearm. Nervus axillaris innervate deltoideus surface. Nervus supraclavicularis innervate musculus teres major and musculus deltoideus. This surface. This is nervus supraclavicularis. Nervus axillaris innervate skin of musculus deltoideus. Then we go nervus nervus cutaneus antebrachii nervus cutaneus nervus cutaneus brachii nervus cutaneus antebrachii is two independent nerves of the medial bundle. If we say this is ventral surface, this is dorsal surface. Nervus radialis innervate posterior surface and lateral surface of arm, and on the dorsal surface it's innervate the arm posterior surface as forearm posterior surface. Understand? We common all nerves, common of nerves. So for end, a nervus muscula cutaneus innervate the lateral surface of forearm. Understand? If we say about forearm, nervus muscula cutaneus, nervus cutaneus antebrachii medialis, two nerve innervate. Nervus muscula cutaneus lateral surface, nervus cutaneus antebrachii medialis, it's independent nerve, innervate this surface. Understand? Two nerve. If I make this, nervus radialis innervate posterior surface, nervus muscula cutaneus and nervus cutaneus antebrachii medialis, this surface. Understand? On the ventral surface, two nerve, dorsal, free nerve. It's about forearm. If we go to the arm, nervus supraclavicularis innervate this place, nervus axillaris this place, nervus cutaneus brachii medialis innervate nervus cutaneus brachii medialis, and this surface innervate the nervus radialis posterior and lateral nerve. Posterior and lateral nerve. Understand? At home, if you revise, you understand. It's not difficult. Maybe once, but if you teach this once, you get spinal nerve. It's only one spinal nerve that not making a plexus. We have plexus cervicalis, plexus brachialis, plexus sacralis, but we not have plexus thoracicus. Why? We have 12 nervus thoracicus, and this nerve located in the spatium intercostalis. Between two ribs. This is nervi intercostalis. Maybe you feel a pain when you run. Pain. It's nervus intercostalis. It's nerve located between two
Intercostal muscles.
Yes,
in between.
Yes, intercostal muscles located between ribs. How many ribs we have? 12. So we have 12 nervus intercostalis. What innervate this muscle? We innervate muscles of thorax, but not all muscles, only deep muscles. It's musculus intercostalis externi interni, musculus subcostalis, and musculus thoracicus, musculus transversus thoracicus. I remember the muscles of thorax. We have musculus pectoralis major, minor, musculus subclavius, and musculus serratus arterius. It's superficial muscles. And we have a deep muscles. Musculus intercostalis externi interni, they located between spatium intercostalia. Nervus subcostalis located below the rib, and musculus transversus thoracicus located in this nerve, musculus transversus thoracicus. We innervate this four muscle on the thorax. On the abdomen, what muscles of abdomen you remember? Obliquus, externus internus, musculus rectus, musculus quadratus lumborum. What else?
Transversus abdominis, rectus.
Rectus
abdominis हो
abdominis,
गया
musculus transversus abdominis,
and colle transverse longus colle
no, it's
colle
abdomen. Nervus abdominis lumborum on this dorsal surface, this muscle, innervate nervi intercostalis, and we innervate two muscle of the spine, musculus serratus posterior superior and musculus serratus posterior inferior. These two muscle of the spine innervate nervi intercostalis. Only one, two. Musculus serratus posterior superior, musculus serratus posterior inferior. Yes. And on the chest, we innervate the deep muscles. It's not present on the picture. This is musculus intercostalis externi interni, musculus subcostalis, and musculus transversus thoracicus. And abdomen, all muscles of abdomen. And nervi intercostalis is mixed nerve. Muscles we discuss, and the terminal branches of nervus intercostalis innervate the lateral surface of skin, thoracic and abdominal cavity, and anterior surface. This and this surface we innervate the skin branches, and we innervate a glandula mammillaria, skin of glandula mammillaria of man and woman. Understand? Revise. Nervus thoracicus called nervi intercostalis, located in the spatium intercostale and innervate two muscles of the spine, musculus serratus posterior, superior, inferior, four muscles of thorax, musculi intercostalis externi, musculi intercostalis interni, musculus subcostalis, yes, and musculus transversus thoracicus. Muscles of abdomen, we innervate, yes, and the terminal branch innervate the skin, the lateral and anterior surface of abdomen and thoracic cavity, and glandula mammillaria too. Understand? And this nerve is mixed and not making a plexus. When I show you the picture in the making branch, and these have a segment direction, is the direction, segment direction, thoracic nerve. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And located between ribs in spatium intercostale and not making a plexus. Have a straight direction, not making a plexus. Cervical nerve making the branchial making plexus, thoracic not make plexus. You should know what innervate. At the next class, I ask you to. This is brachial plexus, long branches, and thoracic nerves. Yes. For today, it's all.